So our next session is GP Pathway Your Way, and we're going to have representatives from both colleges, RACGP and ACRM, share information about the training pathway from medical school through to fellowship, focusing on the ACT and surrounds. So to start off, I would like to introduce Dr. Betty Ye. So she's representing RACGP. She's a GP at Ochre Medical Center in Garan and a local medical educator for RACGP. She's also an AMA ACT board director and a past chair of the AMA ACT Council of Doctors in Training. So I'd like to sort of get you to come on and get started. Thanks, Betty.
Thank you. Yeah, no problem. Thank you for the introduction. Can you all hear me okay? I'm a bit shorter. Yeah. So welcome, everyone. It's a very exciting day to see you all. And I'm here to represent the RACGP, like Adnan has just mentioned. I'm just here to talk about our AGPT program, the Australian General Practice Training Program for you. Just a little bit about myself, and thank you for all the titles I'm holding right now. So I would like to share a little bit of my own journey, just to show you the diversity and the flexibility in the training program mainly. So I joined ANU Medical School as a mature age student at the age of 28 after having an ICU nursing career before. And I graduated with the class of 2018 for those ANU grads here. I've seen a lot of you in the first year and new student welcome drinks. And I've taken one maternity leave year during medical school. So I started with 2017 and finished with the class of 2018. And I did my intern year locally in Canberra Hospital and North Canberra Hospital as a PGY1. And then I took another year off for my second child in my mat leave. And then I rejoined the program and did my residency year as a PGY2, again locally. So all my medical training is done here in Canberra. And then I did my GP training. I went straight to GPT training after I turned PGY3. And I did 2 years of full-time GP training. So as of last year, May 2024, I was a freshly minted GP fellow. So a lot of the college faculties were there in my own graduation. So I'm kind of transitioning from a trainee's perspective to a post-fellowship perspective. So that's my own journey. And since I turned to a fellow myself, I joined the college as a junior local medical educator because the college felt as a new GP and a new fellow, I've just finished my own training journey. So I've got my own personal lived experience to share with you. So from that perspective, if you have any questions or particular concerns, I'm very happy to have a one-on-one conversation with you. So a little bit about the RACGP College. So I think it probably doesn't need a lot of introduction to a lot of you, but for those medical students who's yet undifferentiated, so that's the College of our General Practitioners, and it is certainly the largest college for the general practitioners and medical practitioners here in Australia. And in total, we've got 40,000 membership, so that's a lot. And majority of our membership, as you can see in the number, actually lies in rural workforce. So we've got 24,000 member in the rural setting. So when you join our college, you're not just joining the education program, you're joining a community. So that's a community of registrars, educators, fellows, and non-clinical staff who will support you throughout your journey as well. And certainly, I'm very excited if you are interested in joining the program or in the future is considering the AGPT training program. This is just a one slide to show you that diversity, because I think that's one of the keywords today in the theme, to explore the GP and the diversity of career pathways that's ahead of you. So there we have 4 different GPs, very different GPs. They're all GPs working in their specific interest area. As you can see, we have people who do medical education, such as myself. We enjoy, nurturing the next generation of registrars and fellows. And they still have their own specific interest area in ADHD and eating disorder. And then you can see Dr. Lee over here, and she certainly does a lot of advisory policy work and the work for a lot of health policy domain, advocacy domain. And then you've got Dr. Hughes, and then she's obviously a RG rural generalist with focus in procedural such as obstetric care. And then last but not least, we've got Dr. Tucker here. And he works in that sports medicine field, if that fills your cup. So it's just showing you can really make the career what you want. Okay, so you're starting off as general, but then you can pick specific area, which I will emphasize on in the training program as well. And then the program. So I said I'm talking about the AGPT program. So this is a program that's funded by the Australian government, and it is across all settings. You can do that in metropolitan and rural settings as well. And it's a total of 3 to 4 years of full-time equivalent training time. And you can certainly train part-time. I chose to do full-time, but for those with different needs and different requirement in your working settings, certainly it's a very flexible program. You can choose to train part-time. I usually say to all my registrars, I say, this is a journey, not a race. We don't all have to race to the end in a rat race and everyone trying to finish as soon as possible. So you can certainly tailor it to your own needs and your study requirement and exam preparation. And what does the training look like? So it's certainly a wide range of support that you will get. As I said, I'm one of the local medical educator, so I force right bang in the left in these columns. And then you will have your own supervisors. I think we've got some really great supervisors here sitting around, so they will provide on-the-ground supervision for you on your daily practice. And then we also have other practice training programs, so there are mandatory and non-mandatory training programs and hours you need to attend. And then there's also the different opportunities to tailor to you for your specific interest area if you have one. And the training structure, and we can see the training structure, like I said, is 3 to 4 years in total. And then after you join the program, the first year will be a hospital-based year. So for me, I joined the program as a PGY1. So as an intern, I applied for the program and got accepted. And then I started the training with the college as a PGY2. So my resident year is the first hospital year that I had on this slide. And then you can apply for the RPL, we call it. That's a recognition of prior learning. If you already had extensive hospital exposure before, such as overseas hospitals or local hospitals. And then the college will consider that and reduce your requirement of training time if you are deemed eligible. And then for the second and third year, I walked us through exactly this. So you will do 18 months of full-time equivalent, I should say, of general practice community training, and with your in-practice supervision and education support, such as educators from the college. And then you will need to do 6 months of extended skill term, I will call it. And then this is the opportunity to hone your skill in the specific interest area and subspecialty. There are a lot of opportunities and diversities in how to do your extended skill. A lot of people choose to do dermatology, women's health, mental health, sports medicine, you name it. So really you can make it however you like it. And for that extended skill, depending on what you choose to subspecialize in, you can choose to do it in hospital, community setting, and we also have academic posting as well for those who are willing or are wanting to go into academic field or research field. And then we've commented on the 3-year pathway. Here we have the rural generalist pathway. So this is for those who are rurally minded and wanting to extend your skill in the rural generalism and wanting to go to rural locations to practice. So that will mean you need to do an extra 12 months. We call it ARST, the ARST. So that is, you need to pick an area again. So it can be general practice, but most people will choose such as palliative care, some skill or knowledge area that's in high demand to your rural location or community. So a lot of people will choose obstetrics, anesthetics, ED, pediatrics, healthcare. Again, there are a lot of opportunities in the rural settings, and there are a lot of great supervisors and trainers out there to support you in this program. So that's why the training program is 3 to 4 years, depending on whether you want to do the rural generalist training or not. Okay, and you can opt in anytime throughout your training as well. For those who's a little bit undecided or you're not sure what your family situation is, you don't have to make an immediate decision. You can enter the program and you can opt in the rural generalist stream if you wish to later in your training as well. Okay, so you don't have to immediately know, because a lot of us do not know in the beginning of the training. And the hospital year, so for those who are currently in hospital year, this is probably more relevant. For the medical student, this is some of the preliminary requirement before you enter your community terms. So after you join the program, you need to do a 12-month full-time equivalent of hospital time. So for a lot of the local medical graduate, it just means your PGY 2 years if you join as a PGY 1. But for those who's got lots of hospital experience, like I said, you can consider to apply for the the RPL, then we acknowledge some of the hospital training you've already done, but then you do need to put in the appropriate paperwork for that to be acknowledged by the college. And here we've emphasized that, but you don't have to complete this whole year before you apply. Like I said in my own example, you apply as a PGY 1. You haven't yet finished your intern year and you haven't had your general registration, but so long you're in a secure employment, your intentions to complete your hospital time, and then we can consider your application. And after you join, you just need to have an extra 12 months after you gain your general registration. Okay, and this is a great opportunity during these 12 months to acquire your pediatric training requirement. So for those who are currently in hospital in that PGY 1, 2, and you're considering joining the program soon, so you really need to pay focus to the pediatric mandatory training requirement here. So what is the pediatric requirement? I really drill this. So for those who are in the hospital right now, I want you to take out your phone and take a photo of this, okay? Because this part is the confusing part, and sometimes the registrars are not quite sure how to proceed, okay? If you're seriously considering joining the program in the near future, in the next 12 months or so, I think you should, take a photo of these, because these are some of the ways you can achieve that mandatory term, because this has to be fulfilled before you are putting to the community program and start on the ground with our GP practices. And this is usually the speed limiting process to some extent for our training, because some trainees are very keen and they've got, say, 5 years in the hospital already. However, they have not had enough pediatric exposure, and that will limit their progress into our training program. And I've certainly helped a lot of registrars to explore this maze and how to get this done as quickly as we can to qualify you to enter the general practice. And the next part is how to demonstrate you've already had the hospital requirement. This slide applies more to our IMGs who are international graduates who may not have the local PGY 1 to that progression. So if you've already got the AMC PGY 2 certificate, then you'll be qualified. So you've already had those 24 months in total hospital time. We acknowledge that. But then again, you still have to qualify for the pediatric requirement. Okay, so if you've had, again, 5 years of overseas hospital exposure, say in general surgery, but that does not qualify you to enter general practice training straight away. You still have to demonstrate that pediatric requirement. Okay. But then for those who don't have the AMC PGY 2 certificate already, so long you've had your general registration and you can demonstrate you've worked in a hospital that is accredited for 12 months equivalent of training time, then you can, qualify for the program. And the pediatric requirement remain the same. I feel like a broken record. So get that pediatric experience, if you're seriously considering general practice, because it's just such an essential element to our daily practice. And it will be super, super helpful to you in your professional growth as well. So where can you train? So there are lots of locations. So this is just our training region. So we belong to the Western New South Wales, and we're the Murrumbidgee and ACT region. And for those who are considering moving interstate, each state's got their own training region, and there's a total of 10 around Australia. So if you're interested in other states, you can look up the map and see where exactly are the locations that you can train, particularly for the rural generalist, and where are the hospital based. So exams, because we're all about exams and finish and get fellowship. So I'll slightly touch on the exams here as well. So for the RACGP exam, you've got 3 parts. So the first 2 parts, the AKT and KFP, are the written exams. And the third element, which is the CCE, the clinical competency exam, are similar to OSCE stations. So they are clinical stations, and then you have to interact with patients or educators to demonstrate your clinical skill. And you can only sit part 3 after completing your part 1 and 2. And then you can qualify to sit the exam after your GPT-2 terms. So when you finish the first 12 months, full-time equivalent of GP terms, you are qualified to sit if you choose to sit on the first go. And for the rural generalist, you will have a specific exam that's tailored to the subspecialty area you choose to take your expertise in, and then during that 12 months of extended skill. Your next step, please apply. So it's going to open very soon. So the online portal will open on the 3rd of March, and we'll keep that open until early April. But my suggestion is to apply as early as possible if you're thinking about it, because there will be document that's required to be uploaded and certified. So I think, if you take the opportunity, look through the website and apply as soon as you could, and I think that will put you ahead of the game. So check your eligibility, because I think for those who are here, I think most of you would already have these criteria fulfilled or on the way to fulfill these criteria. You have to have a medical qualification, that's undergrad or postgrad, medical training you've done with medical school, and then registration, that's essential as well. You do have to have a valid visa, either you're a citizen or resident, because I think I was a resident when I started the training, but we do have IMG who come from overseas. But so long you're working, your visa allows you to work, and then you can start the training program as well. And also, there are peculiar situations, people who have attempted exams, and there's college requirement of how much time you can have or are allowed to have to sit the exam. Just check you have enough time to sit your exam as well. And our lovely Jackie, who's manning the station on the back, we've got a lot of brochures and pamphlets with the detailed information if you're interested or if you're thinking of applying in this intake. So, like I said, again, apply if you are thinking about that. And then for the selection criteria and the selection process, you do need to sit assessment, but this is a very easy assessment. And for those who are ANU students or locally trained, it's similar to our PAL setup in ANU, the professionalism and legal ethics requirement in your general practice. This is not a medical knowledge exam. It's rather your judgment and your situational awareness and judgment. And if you're not sure what that is, you can certainly Google that. There are a lot of question banks out there. I remember I have to do some practice question before I set the exam. And the exam fee is $190 for that. And then once we've set the initial assessment, we will assess your application, and you will receive your training outcome. And then when you enter that, we will engage where you would like to be allocated and what's your training intention, and to make sure you're matched with the practice that suits your education demand and will suit your special interest as well. And then these are some of the QR code and brochures that you can grab off us. And there will be a webinar that is organized by our Become GP team. And then if you're interested in that, we'll keep you posted as well. Any questions at all? So I've left my email here. Again, you're more than welcome to take a photo of that if you have any further questions or specific issues that you want to discuss, very happy to put you, in connection into the links with the right people. Okay, thank you.
Thank you very much, Betty.